And I'd like to welcome to the stage Dr. Alex Toth, COO of InView Analytics.
Imagine this. You're trying to search for an antibiotic for your sick child. You visit pharmacy after pharmacy, and it's just not there. You call all the pharmacies you can think of, and they're telling you the same thing. It's simply out of stock. It's on back order. So what do you do next? Well, you can try searching the internet for that medication, and you might find some information about it. You might find what it does, but you're not actually going to find where that medication is located. And it's kind of crazy to think about, because you can almost search for any other product out there, say a piece of tile at Home Depot, and immediately see what aisle it's located in and how many are on the shelf, but you can't do that for your child's antibiotic right now. It doesn't make sense, and it's a frustrating and heartbreaking situation that patients shouldn't have to go through. Unfortunately, this is happening right now as we speak in pharmacies across our country. In my experience as a pharmacist, I once had a day where a patient had to visit 10 different pharmacies to find an eye drop for their child. In my professional opinion, this is a public health emergency that needs to be addressed. And this is the reality that inspired me to co-found InView Analytics. My name is Alex Toth, the Chief Operating Officer. Across the United States, patients as well as healthcare providers have difficulty locating medications when they're needed for patients. Often, the situation isn't that that medication isn't out there in the marketplace, it's simply in the wrong place at the wrong time. This happens so frequently that there's many situations where pharmacies will actually have to source that medication from within their own internal network of pharmacies or even outside their network of pharmacies. This type of redistribution occurs every day and is actually going to be facing some increasing scrutiny at the end of this year. And this is where InView Analytics steps in. We have created the first inventory management platform that not only centralizes data across siloed healthcare systems, but we also optimize that data to make sure that medication is in the right place at the right time when patients are looking for it. Our consumer-facing platform, InStockRx, actually allows patients to search in real time the inventory of their local pharmacy shelves, so that way they don't walk through those doors and hear those words, "I'm sorry, we're out of stock." The pharmaceutical marketplace is ever expanding and vast, with billions of dollars worth of pharmaceuticals going through pharmacies every year. There's also billions of dollars worth of waste every year that gets thrown away by pharmacies that could be better redistributed to patients. We have already established relationships with key players in the industry in order to establish this medication relocation and location as a service, with the goal of eventually reaching all 88,000 pharmacies that are in the United States. Our revenue model is simple. It's a subscription-based service where pharmacies pay a monthly fee to participate in our network with a targeted revenue of $4,000 per pharmacy per year. That being said, our organization also has a diverse revenue model that also incorporates in pharmacies, consumers, as well as manufacturers spend. So that way our revenue will grow in tandem with our company. We are already gaining traction, establishing key partnerships and collaborations with different state pharmacy associations. As we move forward, our sales strategy will be focused on demonstrating our platform's value to pharmacies, healthcare providers, and most importantly, patients. Our team is experienced professionals in the industry. I bring over 10 years worth of experience as a pharmacy owner and operator. Our CEO, Jeremy, brings over 15 years of experience working in fintech and software engineering, and our lead technical advisor, Yaron, brings over 15 years of experience working as a software engineer for companies such as Walmart as well as Meta. Our team has the experience and skills necessary to make this platform a success. We currently have a platform that is already built, live, and with paying customers. We are seeking investment in order to help scale our operations, enhance our product, and expand our reach with the goal of all 88,000 pharmacies being in our network. We are not simply just building a platform, we are building a future where no patient has to walk into a pharmacy and hear those words, "I'm sorry, we're out of stock." Thank you for considering our pitch, and we look forward to the opportunity to partner with you in order to change how patients and pharmacy receive care in this country. Thank you.
Thank you. We'll now move on to questions.
Sure, I'll start. So I imagine a major factor of this is the integration with the pharmacy management system. Can you talk a little bit about that? Is it one-way, two-way? How complex is it?
Absolutely. So that's actually one of the biggest hurdles that we initially faced. There's tons of pharmacies out there, and almost every single pharmacy has a different pharmacy management system that we have to integrate into. There's multiple different platforms, easily over 20 to 30 platforms that are like the key players in the industry. We have established a number of partnerships with those organizations, and we're adding on more as we add on more pharmacies within our network. Some of them we have two-way feed in which we can push data back into them, but primarily it's a one-way feed in which we receive data from that. The great part about that is that with these pharmacies, they own their own data, so often there's little to no fees associated with any of our integrations with those software companies.
Great, thank you.
Alex, you mentioned that you've got a multi-sided revenue model over time. Can you just speak to how you're thinking about scaling the near to mid-term versus the long term?
Okay. So right now, as I mentioned, our current revenue model is focusing strictly on pharmacies with that monthly recurring revenue from the pharmacies. As we move forward, for the consumer aspect of it, we plan on integrating in coupon aggregators, which will take a percentage of that transaction. The real benefit with our particular program is that not only will the patient be receiving the best price, they're also going to be actually directed to a pharmacy that has that medication in stock. Because one issue that we face as a pharmacy right now, the patient will bring in a coupon from any site out there, and there's no guarantee that that medication is even on my shelf. So that's the consumer side of things. And then from a manufacturer standpoint, this is something that we started considering as well, because there's oftentimes that a manufacturer will end up bringing a product to market and there's more demand than they have supply. For example, a real good one of this is like all the GLP-1 products like our Monjuros, Trulicity, Ozempic. So we actually have the reps coming into our stores trying to locate and see if we actually have that product. So we would be able to create portals for manufacturers in order to allow their patients to search that portal instead of having to call up the manufacturer and speak with a rep and have them start calling around for stores. So that's our manufacturer revenue model.
Just super quick follow-up. So when do you think about the right time for the business to expand into those other revenue opportunities?
Well, it's always going to be a chicken or egg type situation, because we need to make sure we have enough pharmacies in our network in order to demonstrate value for our consumers, because it doesn't help us if a consumer goes out there and searches their state and they have nobody in their network. So we're looking to establish in key areas, like right now we're focusing on the New Jersey, New York, Pennsylvania area to establish a significant number of pharmacies, and then that's when we can start rolling out with our consumer model in there, and then once we have enough pharmacies and consumers using our platform, then that's when we want to take it to the next level of manufacturers.
Alex, can you talk a little bit about how you decided to price for the pharmacies, both in terms of how they perceive their ROI, but also just given the health of independent pharmacies, how you think about trying to be a good partner to them?
Okay. Yeah, that's something that we definitely had to take in consideration. Truthfully, when we first started with the platform, we had a slightly higher price point, and we ended up adjusting it to something that a lot of our beta test sites were more in line with and what they could support. The reason why we ended up pricing it in this model is that one of the main benefits of having that pharmacy participate in our network is that they were going to be introduced to new clients that are out there. I typically price a client, a new patient coming into my store, somewhere around like $75 in terms of like what our normal spend is to attract one of those patients. So at that $300 price point, the pharmacy is going to be breaking even at about 4 clients per month.
Maybe I'll ask one more. You had a slide that showed the partnerships with GPOs. Can you just touch a little bit on how you could potentially work with them?
Yeah, so that's something that we're very excited to be working on right now, is some partnerships with the group purchasing organizations. A lot of these organizations are running into a problem where they're not able to decrease their cost of goods anymore, and they're looking for a lot of value-added services to add on to their participants, mainly pharmacies. So we've been approached by a number of GPOs in order to provide our service as a value-added service for their pharmacies, so that way they can help to attract more patients walking through the door. That way they can help to reallocate their inventory a little bit more appropriately and decrease waste, because there's only so much further these GPOs can do in terms of decreasing cost of goods. So this would be a value-added service that they're looking to add on to their pharmacies.
Can you talk a little bit more about the sales or the go-to-market motion? I think you said on there that you were planning on scaling up the number of sales reps you have.
Yes, correct. And that's where a significant amount of our revenue or of the funding would go to. Like I said, we already have a product that's completely built, live, and functioning, but we just need to get the word out there and get as many state organizations and on board. So that's going to take a significant amount of sales team. Part of the pharmacy industry is driven heavily by trade shows as well, which can be very expensive. So scaling up our sales team, attending a lot of trade shows, and getting more and more pharmacies to sign up to establish that first revenue model before we can move on to consumers and manufacturers.
So it would be largely field sales.
Yes.
Okay, got it.
Alex, are you hearing anything from the pharmacists related to like other things you can do in their workflow, just to like expedite the throughput through their retail environments?
Well, pharmacists always run into the issue of not enough time in the day, and they're getting hit from every single angle. One way in which our platform helps them is essentially we're decreasing those phone calls to the pharmacy. Because something recently that happened, say for the Tylenol shortage that happened a couple of months ago, we were having.
I'm sorry, Alex. That's all the time we have. Thank you so much.